you've been struggling with fatigue, weight gain, brain fog, or mood swings, and you've tried hormone treatments, diets, or procedures without feeling better, this episode is for you. Today, I'll explain what's been missing and why focusing on your metabolism is the key to lasting results when it comes to these symptoms.
Today's episode is sponsored by Vitality Health RX Supplements. Whether you're an athlete, a busy professional, or just someone looking to prioritize health, Vitality Health RX has what you need. With premium ingredients and rigorous quality control, their supplements support your body's natural functions. Visit shopvrx.com and use code FEELGREAT15 for 15% off your first order. Thanks to Vitality Health RX for sponsoring this episode. Now let's dive in.
Welcome to the Feel Better, Feel Great podcast and community. This is episode 149, Fixing Hormone Imbalance for the Long Term. What you need to know and what you need to avoid. I'm Dr. Andrea McSwain. Today we're talking about something I see all too often, hormone imbalance, and why the quick fixes you've been told actually might make things worse. If you're new to me, click on those notifications, click on the bell, and hit the subscribe button for this channel, Dr. McSwain. Please also remember that this is for educational purposes only. If you have medical condition or you have health objectives, please discuss that with your doctor or primary care provider. In this episode, I want to address at least a few objectives. Common mistakes in hormone therapy, treatments and procedures that may worsen your hormone balance, and how actually prioritizing metabolism leads to sustainable improvement. Okay, what you're being told about fixing your hormones. So there's the quick fix, right? I think I've said before, but when I first kind of shifted to my own way to provide care, if you will, I mean, obviously in the constructs of osteopathic medicine, OB-GYN residency, holistic training from Dr. McGarry, I was told, if you're starting your own practice, be the hormone doctor. And I refused. I wish someone had said, be the GYN doctor. Or they said, be the hormone doctor. This was, 10 years ago, this was just a different conversation. And I was like, I will absolutely not be the hormone doctor, because I am not just someone who puts something on someone without appreciating the good, the bad, and the ugly. And when you just give someone hormones, right, that's your first line. That's what you're receiving as a patient, is your first line is hormone therapy. You are drastically missing some very important things that are the sustenance of how your body works. And hormones are kind of the hormone modulation is the cherry on the top, right? That's the refinement, the tweaking, things like that. So if you're a man and you're 50 years old and you're exhausted from work, and yes, you want to do all the heavy lifting you used to do, but now you're focused in the office and your body's going to mush and your brain's exhausted, and you get to the doctor and you say, I don't feel right, and they say, here's some testosterone. Just back up slowly, right? Acknowledge the fact that your metabolism is being disrupted, and if you take a hormone as the sole solution, right, the quick fix, you're going to now have more than one problem. A lot of times, too, people will look at the quick fix like, here's your hormone replacement therapy, here's your estradiol, here is your birth control pill. So that's two different things. So let's just get back to hormone replacement therapy. And there's not proper testing done. Remember, too, cortisol is a very important hormone, and that's your stress hormone. And if your stress hormone is not functioning as the way the stress hormone does throughout the day, and it has a very distinct pattern of how it releases stress throughout the day, and I'll show you that chart so you can find that in our guide. But the other thing is that we look at the other hormones, often the sex hormones, right? Estrogen, progesterone, testosterone. Those are the main ones. DHEA, big win, because it's an adrenal hormone that affects the gonadal or sex hormones. In any case, doing any of these without testing is extremely problematic. So first of all, getting hormone replacement therapy as a quick fix, and the solo or the primary action is significant problem. Second, giving hormone replacement therapy without proper testing, and also without the proper interpretation of that testing. So hormone replacement testing is actually difficult to evaluate and analyze. And there are people who are not physicians who are attempting to do this analytic, and I believe that it is a disservice to the community. Currently, I use the Dutch test. It is the benchmark for hormone replacement therapy. I do understand that Vibrant Wellness is coming out with a hormone test that will soon include hormone disruptors. So stay tuned for more information about that. But for right now, the mainstay testing, just so you know, is Dutch. Now you should be looking at hormone testing much later in your therapeutic journey after a lot of other organ systems and communication systems in the body have been addressed. So if you put hormones and replacement first, it's going to be a problem, and it's rarely actually the fix. It's actually rarely the fix. Why this can make things worse? Your hormones are communicators. Your hormones work as a team. If you add one or reduce another one, then you further create imbalance. So if you look at how estrogen relates to cortisol and insulin, and you look at even larger dynamics there, then you can actually exacerbate imbalance. For example, using estrogen-dominant therapies to reduce fatigue may likely spike insulin resistance, leading to weight gain and more fatigue, which is exactly what you're trying to avoid. So then, after you understand kind of that as a concept, you have to understand that there's a lot of systems in the body, and going right to hormone replacement is not addressing the actual systems of the body that lead to long-term problems, and you might find a very quick fix with hormone therapy, but another problem is added to your list now, and it actually can exacerbate the problems that you originally had. Then we look at hormonal procedures and treatments that may worsen hormonal therapy. And I already said that by giving testosterone to a 50-year-old guy who's doing less with his muscles and more with his brain, and he's exhausted, and now his body's going to shut down his own natural ability to make testosterone. And we have a lot of problems with that because it's a gonadal hormone replacement, but he likely has adrenal fatigue. Birth control pills for hormone regulation is straight up wrong. Whatever age you are, whether you're 14 or 35 or 49, if you've been put on birth control pills to regulate your hormones, that is not it. Birth control pills are a massive hormone dysregulator because it's a ton of fake estrogen, clogs up the liver, it's a ton of synthetic progesterone, confuses the body, and all you're doing is dysregulating it so that you can't get pregnant, okay? Because when your body is dysregulated, it will not get pregnant. That is the point. That is the whole point about birth control pills. Load someone up with enough synthetic hormones that it actually causes disruption to the system. Now, that is a very long conversation. If you want to go directly to the source, it's Dr. Spiroff, Reproductive Endocrinology and Infertility textbook, one of the critical gynecologic textbooks for training and understanding this concept. However, birth control pills are often used for hormone regulation, and it is disturbing because birth control pills are inherently designed to disrupt the natural organization of the body. So why would you take a hormone disruptor, like a birth control pill, to regulate your hormones? And you need to view it that way, because that line of thinking to take birth control pills for hormone regulation is not line up. Birth control pills are designed to control birth. There are a lot of other methods, 4 or 5 of them. There's also another way you can use your own patterning and actually testing, home testing for this. If you want more information about that, put that in the comment section, because I've been really working on how to present that to people, and I'd like to know if you're interested. Also recognizing that, like I said, there's many other ways to support birth control that is not a pill, that is a hormone disruptor. So that's usually what I talk to people about. But when they come in on birth control pills for hormone regulation, I switch that immediately. Absolutely. The other thing that's a treatment for hormones or a procedure for hormones is placing hormone pellets. This can create extreme highs and lows, and it is permanent for the duration of the pellet, which can be several weeks, if not months. Additionally, there's invasive weight loss procedures. This can stress the body further and worsen hormone balance, particularly for women. They have a very high failure rate for weight loss procedures. Imagine doing something that has a permanent alteration for your body in an effort to have a health goal met, which then actually doesn't work, and it makes it worse because now the system of the body is permanently disrupted. There are also adrenal boosters. If you're getting an adrenal booster from the gas station, it's a bad idea, all right? If you're getting an adrenal booster from TikTok, probably also a bad idea, like with love and respect, because adrenal boosters are adrenaline, right? And you have to navigate the adrenals because we're not always in full throttle. And a lot of these adrenal boosters are now putting your body in full throttle. So you can use an adrenal booster by going and getting called like a red eye. Has anyone ever had that at a coffee shop? It's like a coffee with espresso shots. And I've met a few people, 2 men in particular, and they were adrenaline junkies, and they were known at their local coffee shop, right? Because they would get like a quadruple shot in a cup of coffee. That is an adrenal booster that will drive you into sympathetic overdrive, and you will crash and burn. Because, first of all, you cannot run at high RPMs in your body 24 hours a day because we're not designed to. Our adrenals are actually designed to have a peak in the day and a trough in the day and a coast period. So if you support those times in your body, you can really be feeling very good because you're naturally supporting your hormones. Actually, your lifestyle is a really great way to do that. And this is why treatments fail, because we are addressing the symptom, if you will, with a hormone therapy. So that's very problematic. It's just not it's not creating balance. And also, we have to address hormones in our natural organization methods of metabolism and lifestyle foundations. So I have had patients who've tried hormone pellets for energy and to feel good, but later to find out that they had significant mood swings, weight gain, and they ended up being more in a crash and burn dynamic. I want to just make sure you're aware of these things. It kind of goes down to maybe a little bit of a tangent, but it's really important as a doctor and a healthcare provider to provide education, options, and recommendations, right? So it goes in that order. Education, options, recommendations, EOR. If you are only offering someone recommendations, you are not providing patient autonomy. I say that to you as a patient because I think most people who are listening are patients. Although healthcare providers are also patients, right? And if you are not educating someone, you're not giving them options, and they're only giving them recommendations, these are how those things happen, right? I recommend you take hormone pellets because your hormones are making you feel tired and sluggish and gain weight and you have no libido. Yeah, I'll take hormone pellets. You're actually not agreeing to hormone pellets, right? You're agreeing to a solution to your problem. But you've only been given one recommendation without options and no education, which would say hormone pellets might actually be really good for you. We see that in X number of percentage of people. We see X number of percentage of people that doesn't really matter. And we see X number of people that actually have worse symptoms and they actually have their problems exacerbated. Now, what would you like to do? You might not be so hip on using hormone pellets, right? You might instead say, well, what are my other options? I'm like, well, your other options could be, la, 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 la. Okay, well, what is, there you're starting to get some education. When you have options, you're getting educated. And you are the ones making decisions based on education and not just someone's recommendation. In my practice, this is really significant because I feel like people come in a lot of times and they've been given recommendations, and recommendations that may have worked, but not for them. And if the patient had been given options, the patient would have said, you know what, I like this. This option makes sense to me. This option works for me. And I see that all the time in my practice. I give education, options, and recommendations. And I recommend things, and sometimes patients say, well, I like the other option that you presented more. It makes more sense in my life, in my way, and blah, 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 in my whatever, in my finances, in my treatment objectives, in how my family works, all these things, right? All these other considerations that need to happen when people make decisions about their health. And I say, fantastic, because it is your body. It is not my body. My body's not your body. And especially in cases of hormone therapy and hormones impacts on the body, you need to have education, options, and then work with healthcare providers that can provide you with recommendations, preferably based on testing. Complicated testing that requires someone who has the analytic ability to provide you with a path to actually improve the results. And it's important for testing because you really want to see objective data. All right. Now, one of the ways that I want to highlight as the first step is metabolism. What? How can you tell me that metabolism is a foundation for hormone health? It's like, okay, well, if you're sluggish and you have, a fast food diet, you're grabbing whatever you can to put in your mouth, it's not nutritious. You're super stressed out. Relationships are poor at work, at home, with yourself, right? Or there's insulin resistance, which is insulin resistance is probably the best example of hormone imbalance meets metabolism imbalance, right? You start improving your body's working, your metabolism, you reduce your insulin resistance, your hormones work better, okay? So if you address that metabolism reset, right, and get some metabolism mastery, nutrition, movement, stress management, sleep, understanding and receiving education on the normal patterning of the body with hormones, because you have daily hormone cycles, you have weekly, and really you have monthly, and then you have decade hormone cycle. I mean, you can really get into like your whole life and how your body works with the hormones to support you through your whole life. And then you get to some critical transition points. A lot of people don't talk about the transition for teenage years, but that's a really critical transition, and there's a lot of hiccups in it. And I really like working with young women who struggle with that, like more like in group settings or, in that kind of course idea. But then when people get into menopause and they're just told, well, that's menopause, and you should just deal with it or take some hormones. And it's like, oh my gosh, did you seriously say that? Like, don't do that. And don't accept that as the answer. Really, you want to first look at, that metabolic reset, that metabolic mastery, right? Because those are your pillars. Those are your life pillars. They really matter. And those are the foundation for metabolism and how your body works, right? Metabolism is a lot about how the machine works, and you can amplify that machine working with hormones, or you can dampen it if the hormone therapy does not address or actually exacerbates more metabolic problems, right? So metabolic is foundational to hormones. That was a lot of information. Kind of took you on a journey. First we looked at hormones and kind of what you might be receiving as recommendations. And then I wanted to discuss with you the pitfalls of those, some of the successes, but again, that's discussing options and education. And then looking at, okay, maybe another option for you that's more foundational is to make sure that metabolism, making sure the machine is running efficiently, is foundational to your approach. And then looking at how your hormones respond to that, and then seeing what hormone support you need with testing. So that's the structure there. Again, quick fixes might offer temporary relief, but actually they might actually just be confusing the body even more, creating more imbalance and creating more of the original problem, only in a more ballooned effect. But lasting balance starts with working on the machine of the body and working on metabolism. Again, your health is very dynamic. So what may have worked for you before, right? When you look at different patterns in the body and as we cycle through life, what are the changes that are happening and how do we need to address these things differently, particularly at different transition points and also just different stages in life. You don't have to live with hormone chaos. By prioritizing your metabolism, you'll feel better, have more energy, and finally start seeing results. If this episode resonated with you, check out our free guide, Hormone Balance and Metabolism, your first step to feeling better. We'll have a link in the show notes. Thank you for listening to Feel Better, Feel Great podcast. If you found this helpful, share it with a friend, please. Leave a review. That would be great. And really help others discover the show or the podcast. Thank you for listening to the Feel Better, Feel Great podcast. We're really working on building community. So if you found this helpful, I would love to know that. I'd also would really love if you could leave a comment, share this with a friend, because we know people are going through this, and you can just tell the friend like, hey, I found some more education on this topic that I know you're dealing with. I know it's hard sometimes for people to shift this information to someone else, and I feel like, hey, this is a little bit of education, right? You're not telling them what to do. It's education, options, and recommendations. And maybe you can say that too. I noticed you've been given some recommendations. It doesn't seem like they're working out for you. There's probably some more options, but this is education on those options. And that way you're not really telling your friend what to do with their life, right? And you're not really even guiding them to what to do. You're just supporting their education. And that would be great because I would like to support their education. I would like for them to also be part of this community, and I'd like for us to be better together. Until next time, stay healthy, feel better, or feel great.